My name is Jay Andrews. I'll be the moderator. I'm the head of marketing for Oceanit Labs. And I'd like to say a big thank you to the festival and to Roger Jelinek for the opportunity to host this very interesting session that we're going to be having today with Mr. Watumull and Dr. Lee. Dr. Lee will be leading us off. He's presenting his research into functional foods and the science behind nutraceuticals. And then Mr. Watumull will be presenting on the benefits of anti-inflammatory supplements and Cardax. So Dr. Lee, I'll kick it over to you, but first, if you'll allow me to give you a brief introduction. So Dr. Lee is professor in the Department of Molecular Biosciences and Bioengineering in the College of Tropical Agriculture and Human Resources at UH Manoa. He received his PhD from the University of California, Davis in 1990, and his postdoctoral training at UH Berkeley prior to his appointment to Manoa in 1995. Dr. Lee's research includes works in environmental biochemistry as well as agricultural chemistry, the environmental fate of agrochemicals, bioremediation, food safety, functional foods, and even Alzheimer's disease drug discovery. His research addresses problems relevant to agrochemicals and foods for human and environmental health, such as pesticides and pollutants, and foods in the environment. So Dr. Lee, thank you very much for being here, and I will turn it over to you.
Our research theme is agricultural chemistry. We do colorful research, very colorful, golden color, the agrochemicals. We study environmental pollution, food safety, bioremediation, and so on. Chinese money is in red color. So we do pharmaceuticals and nutraceutical research, specifically relevant to anti-Alzheimer's diseases and anti-obesity, for example. And US dollar is in green color. So we study botanic insecticide, specifically focused on discovery of new insecticides and study the mode of action, how to kill bugs. And we study palm tree and industrial hemp for the interest of semiconducting polymers and materials, as well as fine chemicals. We do research in functional food. And primarily three things we do. One is isolate, identify ingredient from food sources and study biological function of those ingredients, as well as study how they work. You look at the beautiful picture. The beautiful picture here is a structure of a natural product called isoorienting. Isoorienting. I will use this name in quite a few slides next. You can see chemists can be art. The picture looks very, very beautiful. And now I want to share three stories of functional food studies that we have done. They are relevant to non-small cell lung cancer cell and obesity and Alzheimer's diseases. We use tools, like we eat meals, we use forks, we use chopsticks, but for us to research, we use simple and sophisticated tools. We also use jars and flasks and tubes, like those looks quite messy. I promise it, it's not boring. It's interesting, it's fun. We enjoy it every day. But we also use sophisticated instrument. And we use a number of techniques. The techniques we used include those in biochemistry, chemistry, molecular biology. We use those methodologies to study molecular and biochemical studies and cellular studies and animal studies. I'm sorry that we have to use animals some of the times. We try to minimize the use of experimental animals, but sometimes we just cannot replace it. We have to use animals, and mice and rats, for example. And then people have reported rice bran. Rice bran is the yellow layer of the rice grain, the outside the white rice grain. And people reported rice bran oil can kill non-small cell lung cancer cells. In other words, anti-cancer. But they do not know, people do not know what the active ingredient causes toxicity, and then do not know how it works. So it's lucky that we have found it. We have isolated this beautiful structure, these beautiful molecules from the rice bran oil. And then we started quite complicated studies. We found it. This is how this molecule works that that kills cancer cells. And we enjoy it. It's fun. It's new knowledge. We get the new knowledge and contributed to the literature. And obesity. Obesity is a very common, serious, and costly disease. As of today, more than 40% adults are obese in the United States. And the estimated medical cost of obesity in the United States was almost 150 billion in 2008. The medical cost for obese patient was more than 1,500 higher than those of normal weight per year. It's a huge cost. So a recent discovery in our lab is that we found a chemical in herbal tea. It can reduce lipid accumulation. In other words, you see those black dot, those lipid droplet. So if we dose the chemicals we isolated, and the number of lipid droplet reduce significantly. And the source of isoorientins, there are a number of food sources that contain isoorientin and analogs. So those are, we've shown a couple of structures of isoorientin and isoorientin analogs. They are in corn silk, corn pollens contain high concentration of isoorientin and analogs. Buckwheat, bambos, guava, and guava contains very high concentration of isoorientin, and many fruits and vegetables. And I want to conclude my talk today. I have shared 3 small stories or ingredient that in functional food we studied. They are potentially anti-lung cancer and anti-obesity, as well as anti-Alzheimer's diseases. And the work done is by my student. I do have a brilliant, the best student. And the thing is, we train students how to do research. Our job is to offer state quality workforce. They know, students know how to do research. And it's fun to do research. I have to enjoy it. It's really not a job. You have to have the passion to work it. And finally, I hope I have convinced you, and please eat healthy food. With that, I do want to thank all my students for their hard work. Thank UH, CETA, my college, and department, and BBE for the support for those years. Thank Roger for the invitation, and Jay and Colin, technical folks, for the support of this event. And I do want to thank your attention. And finally, please stay safe and be healthy.
I will introduce Mr. Watumull. He's the co-founder, president, and CEO of Cardax, a Hawaii-based public biopharmaceutical company. He is the co-inventor of the Cardax technology and is listed on 14 US global patents. More than $20 million has been raised for Cardax since it spun out from Hawaii Biotech in 2006. And he'll be presenting more on the technology, but the Cardax technology combines large-scale organic synthesis and derivatization of compounds found in nature with rigorous scientific development and robust IP to deliver potent anti-inflammatory dietary supplements and pharmaceuticals with the safety of food. Cardax's first product, ZanthoSynO, is the largest selling dietary supplement at GNC in Hawaii and the #1 antioxidant at GNC nationally. And so with that, Mr. Watumull, over to you.
Well, thank you very much, Jay. Appreciate that. It's wonderful to be here, and it's wonderful to see this whole gathering of all these people and the science and the interest that the community has in these events here. So I'd like to start off by kind of riffing off something that Dr. Lee talked about. I think the concept now, the key opinion leaders who are the top people in their field globally, there's a very strong consensus that inflammation is really a major unmet medical need in chronic disease, things like cardiovascular disease, liver disease, Alzheimer's, cancers, et cetera, and even aging itself. It's a very interesting phenomena here that has wide application. One of the most important things that happened to actually validate this important inflammatory hypothesis was a study done by the large pharmaceutical company Cantos. And they looked at 10,061 cardiovascular patients on standard of care, including statins and blood pressure medication, blood thinning medications, et cetera, but who interestingly had elevated inflammation. And the drug that they used was something called Canakinumab. It was an injected monoclonal antibody. It's an anti-inflammatory. And the results were really striking. There were no change in the lipids, no change in LDL, the bad cholesterol, no improvement in good cholesterol, no reduction in triglycerides, fat in your blood. But despite that, they saw a reduction of inflammation, of heart attacks and strokes by 25%, cardiovascular death by 31%, and all-cause mortality by 31%. But unfortunately, they had some severe side effects where they had fatal infections. But still, this was a very, very important trial. We need a solution that requires a unique combination of benefits, including an excellent safety profile that supports chronic use, that does not have the side effects that we just listed, yet it still have broad anti-inflammatory activity with pleiotropic beneficial effects. Pleiotropic mean multifactorial. Oral dosing for convenience and ease of administration, as well as scalable manufacturing and economical pricing. And one compound that we think really does this is something called astaxanthin. That's something that's hard to produce. Took me about 6 months in front of the mirror to get it, but that's the scientific name for it. But what is it? We all know it, actually. It's a naturally occurring marine carotenoid found in salmon, microalgae, krill, lobster, and crab. And carotenoids are natural pigments that impart coloration and support animal health and vitality. And astaxanthin is responsible for turning salmon and shellfish pink. And without astaxanthin, some salmon are gray, maybe that would be obvious, but they're small. They have reproductive problems. They're prone to infections, but very interestingly, they're too weak to swim upstream. So that was our aha moment, that something very, very profound was going on with this particular compound. And it not only had beneficial effects that we see here, we're just listed here for salmon, but we also found that it had very potent anti-inflammatory activity. 50 plus pilot human clinical trials. These are smaller human trials that outline the safety and efficacy, but are not big enough to really get drug approval. More than 20 of those 50 were randomized, double-blind, placebo-controlled human proof of concept studies as well. So there's really some significant data around this. So what about its safety? There have been no significant side effects reported in published human studies with over 1,800 subjects. There's a long history of use in humans and animals. Obviously, animals get it in their diets, and humans eat the fish, et cetera. So we've had a millennium-long exposure. And there's been extensive safety testing. I'll just give you a flavor of some of that safety here, because it is very unusual. There were no clinically meaningful safety issues found even at these extremely high doses. We looked at everything from acute toxicity to 2-year carcinogenicity, teratogenicity, et cetera. But take a look at these doses. These are doses that, are 1,000, 2,000, 8,000 milligrams per kilogram of weight. And they are in multiple animal models, mouse and dog and rat and non-human primates as well. So an exceptional safety profile really here. Very interestingly as well, inflammation is involved in aging as well. There's an anti-aging gene called FOXO3 that promotes longevity in humans. Much of that work was done here at the University of Hawaii as well. And this study, which has since been replicated in 20 independent studies, and it shows that it confers a cardiovascular disease protective benefit, reduces inflammation. But what it turns out is that if you have the most activated version of this gene, FOXO3, you're 3 times more likely to live to 100 healthy than those who have the least activated version of the gene. Everybody's got a version of the gene. Most people have the least activated version of the gene. But if you're fortunate to have the more activated version on it, you are, as I just mentioned, 3 times more likely to live to 100 healthy than those who don't. And it turns out that in a study, again, that we did at the University of Hawaii, astaxanthin actually increased, one of our astaxanthin compounds increased FOXO3 activation in mice by 90% in the cardiovascular space. In addition, astaxanthin extended lifespan by up to 30% via FOXO3 ortholog activation. That means a similar gene in the earthworm as well. Also extended life as well. I think Hawaii could be a global anti-aging center of excellence. We need a new paradigm for Hawaii. Tourism is very important and very crucial to us in Hawaii. But as we've just seen, it really shouldn't be so important that we are hurt so bad when things happen. And this is not the first time that we've had an issue with tourism. I think that we can actually position Hawaii as the global anti-aging center leader globally. No one else is doing this today. We have a brand already as a health state, as one of the safest states, or the safest state in the country, a blue zone, if you will. And I think we can expand upon that with the actual work that we are doing with the actual products like dietary supplement, and a version of this for pharmaceutical uses, what Dr. Lee is doing, and the other people we're working with at the University of Hawaii, Dr. Brad Wilcox and Rich Alsop, among others.